Thank you guys for coming back to my channel. Today I'm going to be talking about how to pass an interview and how to get an interview. I have made a video on this in the past. It was the first video I've ever made, so it's kind of ghetto. Today I figured I'm going to redo it and add a few more points. I also lost a lot of weight on keto. You might not recognize me. I'm the same person that I was in the previous videos. So I figured I'm all skinny now. Might as well make it with the new skinny body I have now. So stick around and find out more. Hey guys, I'm Daniel from Doldier Media, and today I'm going to be talking about how to pass an interview. This is going to be focused on if you're a nurse or if you're a respiratory therapist mostly. This can apply to other professions in the healthcare field, but this is mostly tuned for nursing and respiratory jobs in the hospital. Before we talk about passing an interview, the first thing we got to talk about is how to get an interview. So if you recently graduated or you're still looking for a job or you already work somewhere and you want to get a different position, the first piece of advice that I got to give you is to fine-tune your resume. Now, how can you fine-tune your resume? The best way to do that is go to the actual jobs that you're applying for, look at what kind of qualifications they're looking for and what kind of description of the job they have, get the words from the actual website itself, and try to incorporate them into your resume. Now, you can't just copy and paste it. It's going to look a little bad. They're going to get red flags on their end. Hospitals these days use algorithms that just kind of look for key trigger words. And I know before in the past, people could just copy and paste, paint the color white on the resume at the bottom, and then apply it to the system. That I'm pretty sure they have algorithms that can catch that now. So you definitely want to avoid doing that. But what you do want to do is go to the actual place that you're applying for your job and look at what they have in terms of job qualifications or job specifications. So if it says something like, we need a person who's able to manage multiple other people, try to use those words, rewrite them, maybe use a few of the words that are in the actual website and put them in your resume. In terms of where you could put them on your resume, it could be somewhere like experience or qualifications or create a whole new category, but just try to incorporate that into your resume. By doing so, you'll have a higher chance of triggering the algorithm so that you actually have your application pulled when they're starting to look for candidates. Everybody's pretty much equally qualified. It's kind of weird, but the only few things that really stick out is those keywords that the system just recognizes and it sends it to management. Another thing you want to do on your resume is try to target the hospital that you're applying for. If you're looking for a place that has specialty in NICU or PICU, or let's say pediatrics, then you want to fine-tune your resume to specifically match the criteria of that hospital. If you're really trying to get a job at multiple places, you might have to have 3 or 4 different resumes. Now, the great thing about it is most hospitals, once you save your resume into their system, you could just upload that same resume to that hospital system. But you want to fine tune your resume to each hospital you're applying for or wherever you're trying to get a job. Don't just get a generic resume and send it everywhere. You want to fine tune it specifically to the place you're trying to work at. So let's say you did exactly what I just told you to do and you get the job, or at least you get the job interview. So what do you need to do next? The next thing you need to do is make sure you're dressed properly. Do not ever go to a job interview in a hospital looking casual or relaxed. I know that a suit might be overkill, or some of you are thinking some kind of a dress suit, or if you're a female, some kind of pantsuit. If you think that's overkill, it's not. This is your only chance to really impress the management team, and you can only stand out amongst 10, maybe 20 other applicants. And if you come in there looking all casual, like you don't care about how you look, they're going to notice that. One thing I've noticed in my experience is a lot of management people in hospitals are ex-military people. And ex-military people, they love when things look neat and they love when people look their best. So you want to look as dapper as you can possibly look. That means wear a suit, wear a matching tie, dress your best slacks, wear your best anything you can think of just so you can impress these people. This is a one chance that you do have to really impress yourself. We don't have the times where you could just walk in, drop off a resume anymore. Everything is done online. You have about 10, maybe 20 minutes to really show off who you are. And one of the ways you could do that is dress the part. So dress as nice as you can to your interview. Now, personally, I wouldn't be chewing any gum. I probably would go really light on the cologne. You don't want to overdo anything like that. You don't want to stand out in a negative way. You do want to look good, but you don't want to stand out in a way where they're gonna be able to recognize you by your smell, or they're gonna be able to pinpoint something that you're doing, like a nervous tic that you have. So try to keep that all away from there. Go to the interview looking fresh, looking spiffy, but try to keep your gum, your cologne, and things like that at home. Now, with all these things, you have a good chance of now impressing the management team. So before we get into a few pointers that I have, I'm going to recap what I talked about last time. If you are looking for a job, these are going to be asked at most interviews you're going to go to. Now, this is not a guarantee that you're going to be asked these questions, but there's a high chance that these are the questions that they're going to ask, or something along these lines. So first question, and this is a recap from my previous video. First question is, tell me about yourself. Now, when they ask you that, you don't want to talk about anything else other than your professional career. Keep it short and simple, kind of get to the point of what kind of experience do you have as an RT or as a nurse. An example of that would be, I've been working for this many years at this hospital. Prior to that, I went to this school and I graduated from this academy with this degree. That's pretty much what they want to know about who you are. Next question from the last video is going to be, why do you want to work here? Now, to answer this simply, they want to see that you've done your research and you know exactly where you're applying. So if you, like I said earlier, if you're trying to work at a PICU and NICU facility, you want to show them that you know exactly where you're going. If the place you work at specializes in cardiac surgeries or cardiac patients, you want to tell them exactly why you want to work there. They want to see that not only do you want to stay there, but that you know exactly where you're applying to. So it's not just like, I want to make some money. Tell them exactly why you want to work there. This is a really good hospital that has a trauma center, and I really always want to work at a trauma center. Something like that. Next question, tell me about a time you disagree with the manager. This is pretty simple. They just want to see that you're going to follow the chain of command, and they also want to see that you're not going to be somebody that talks bad about a previous manager. There's nothing worse you could do than badmouth somebody that you previously worked for. Most often, it's the people that are actually in the interview that are the bad people, not the management team. Management has strict protocol they have to follow, and although some managers could be pretty shady, for the most part, the people who badmouth their old managers are the people who are probably going to badmouth the current manager that they're interviewing with. So avoid any kind of badmouthing. Don't say anything negative about any other manager you have. And then when it talks about when you disagree with them, they want to see that you know how to follow chain of command. It's pretty simple. They want to see that you're not going to go straight to any higher up people. They also don't want to see that you're going to just bicker and hold some kind of grudge against them. Just simply say, I'm going to directly talk to you as a manager, and I'm going to tell you what I didn't like or whatever I needed to do that I didn't agree with, but I'm going to correct my behavior as an employee. Next is, what are your weaknesses? Now, with this question, I said in my previous video that a lot of people like to talk about what their actual weaknesses are, like they love too much or whatever it might be. This is strictly related to your job. So if you're applying in a trauma center, but you have no trauma center experience, your weakness is that you do not work at a trauma center and you have never worked there. So that's what your weaknesses are. It's professional weaknesses. If you've never done any transports, or if you've never done any specific job, or you've never worked with a particular equipment or a piece of anything, then that's what your weakness is. You don't necessarily go over any specific details about your personal life. You tell them what your weaknesses are on the job. So if you're a nurse, but you've never worked with a geriatric patient, or if you're a nurse that's never worked on a telefloor, then you say, my weakness is that I've actually never had an experience on a telefloor, but I'm willing to learn. And you really want to show that you have initiative to pick up any new things they have to teach you. Next, we have time management questions. They're going to ask you about how you're going to manage your time wisely. They're going to ask you about certain scenarios, or at least they have the potential to ask you about multiple scenarios, and they want to see how are you going to manage your time. The biggest issue that we have in the healthcare field is some people do not know how to manage their time wisely. And they get overworked, overstressed, and it becomes a huge problem. So one of the things that every employer wants is to see that you know how to manage your time wisely. So they're going to ask you something along the lines of, if you had this patient, this patient, this patient, what would you do in this situation, or who would you see first? So get ready for that question, prep it, have people ask you these kind of questions, and you'll be better prepared for your interview. And finally, they're going to ask you something like, do you have any questions for me? This is your chance to speak up. This is your chance to show them that you've done your research. So ask them about the place they work at. Ask them about the facility, any kind of new things they're going to do. Show interest in the place you're going to work at. Also show promise that you're going to stay there for a long time. This is the one chance that you have to show them that you are invested into working at that place. That you're not just going to stay there for 3 months and then get another job. Ask them about any programs that might be coming up, any training they might have coming up for any of the therapists or nurses. So this is a recap of the questions that I went over on my previous video. I did it quickly. I summarized it. If you want to get better details on that video, you could definitely watch it. It's my first video I ever uploaded. But now I'm going to go over some other questions that might help you in an interview, and they might help you through the whole process of getting a job. Before going over any other questions, you have to realize that you have only about 15 to 20 minutes to impress the next upcoming manager. You have to place yourself in their shoes. They only have 10 to 15 minutes, maybe at most 30 minutes, to really get to know who you are. Now, in this time, they're going to get a good first impression of how you're dressed, how you look, how you act, what your mannerisms are. And it might be as simple as shaking their hand firmly or not firmly. That might be something that might discourage you. If out of 20 applicants, you're the only one that had a weak handshake, that might be enough for the manager to say, I don't know, something was off about that person. You might have had an amazing interview, but it's as simple as that. And I know it's unfair and it sounds unfair, but that's the way it is nowadays. So with that, understand that it's your only chance to really impress the management team. And they have a responsibility to hire somebody that's going to not only work well with their department, but work well with them. So that's your chance to show them that you are willing to step up, work well with others, work well with them. So don't forget that. Keep in mind that they're not the bad people. They just have to weed out all the other employees and get the best of the crop. Sometimes they don't do a good job at it. Sometimes they do a great job at it. But this is your chance to stand out amongst the other applicants that are going for this job. So question number one that they're going to probably ask you, why should we hire you? Now this question is, it's meant to stress you out, because if you aren't prepared for your interview and if you aren't prepared for this, they're going to know right away by asking these kind of questions. They throw you off guard. You might have been preparing to talk about something else, but them asking you directly, why should we hire you, puts you on a spot. And that's your time to show them exactly why they should hire you. Typically, people resort to saying something like, I'm a great asset to the team, or something very generic. It's not a bad thing to say that. But what you want to focus on in answering this question is exactly why are you valuable to them? What kind of experience do you bring? What pluses do you have as a person or as a therapist or as a nurse that will really help this department? So you want to see what kind of departmental needs they need and how can you help them in terms of what they actually need. So a question like, why should we hire you, is simply answered by saying, I have 5 years experience working on this floor or with these kind of patients. I'm going to be a great team player and I'm going to be good for the team. I've always got along with my coworkers and I like having a good positive environment. Something simple like that. But either way, that's a question they're probably going to ask you, so definitely get ready for that kind of a question. Question number two, what are your plans for the future, or what are your plans for the next few years? They want to know that you're going to stay there in the long run. So typically hiring a new employee costs a lot of money. You have to get trained. There's a lot of time that has to be allocated to training you, to getting you signed off, and all these other things. So when they're investing in you as an employee, they want a return on their investment, which means they want you to stay longer than a year. So if you give them any kind of hint that you're not going to be there for the long run, then don't tell them that. Also, don't apply if you're only going to be there for a few months. That's not fair to them. That's not fair to your team. Everybody just starts getting to know each other around 6 months. That's when you start really getting comfortable at a place. And right around 6 months, if you leave, that's kind of not fair to the whole team and to the management department. So in that situation, if they ask you what's your plans for the future, they want to see that you're going to stay there for the long run. Now, with that also being said, they want to see that you're ready to advance and learn new things. If you just graduated from school, this is probably going to be the highest level of job you have. And for you to think, oh, what else is there? And there's still more learning I have to do. You got to get used to the fact that there's going to be a lot of learning experiences and there's going to be a lot of training opportunities that you're going to have in your job. So step up, tell them that you're ready to learn, and be the person who's willing to learn new things. If your hospital does art lines or central lines or IVs or whatever it is, but you've never done one before, ask them about it, tell them about it. Say, look, hey, I want to get trained, maybe one day become a supervisor. If not a supervisor, I definitely want to be able to use every piece of equipment that we have in this hospital. I want to be a resource for others, and step up, show them initiative. Show them that you're willing to step up and beyond everybody else around you. Question number 3, what charting or what equipment are you familiar with? This is a question that's gonna test what kind of knowledge you have and how much training they need to give you. Like I was saying earlier, it is expensive to train new people, and hiring and the whole process takes a lot of money and resources out of the hospital and out of the department. So what they want to see is that they're going to have the least amount of teaching. That does sound unfair, and for the most part, if there's 5 people and only one of them know a certain skill, and that skill is a lot of time to learn, then you're probably going to be at a disadvantage if you don't know that skill. So knowing what kind of equipment you use, knowing what kind of charting system you use is going to help them understand how ready are you to work there and how little amount of time it's going to require for you to start working. So with this question, you want to give them honesty. You want to tell them exactly what you are familiar with, what you're comfortable with. You don't want to lie about anything. This is just a simple truth question. All you have to do is tell them the truth and you're pretty much solid. Now, it does help if you know more things. It does help if you have more experience. But that's all part of the hiring process. Knowing that if you work somewhere right now, get the experience. Learn as many things as you can so that you can always be an asset to wherever you work. Thank you guys for watching this. Let me know if you have any questions about the hiring process. I know that right now there's going to be a time where there's going to be a lot of RTs needed. A lot of hospitals are expanding because there's been a lot of funding allocated to many hospitals so they can be ready for the next pandemic and then any other things that are going to happen. Or at least not next pandemic, next epidemic, next thing that's going to happen in the world. So get ready to pass your interview. Honestly, you're going to be great. Even if you mess up, it's a learning experience. Let's say you messed up 5 times in an interview, your 6th one, you're going to do a lot better. Not everybody's able to communicate freely and comfortably. Just go as somebody that's ready to learn and learn from their mistakes and grow as a person, also grow as an interviewer. Thank you guys for watching. Hit a like button if you like this video and comment down below with any questions. I love to respond to you guys. Have a good day.